Mantine ensonga eri bwenti tufunye bino ebintu olw'okusonga nina omwana ateera nnyo okulwa ng'alumizibwa mu magumba, abeera amaanyi gonna nga talina awulira gamuluma, abeera buli kaseera ng'amulwadde ng'alina omusujja nga talina ddala amaanyi.
Thank you very much. Thank you. Thank you. Thank you, Dr. Ann, Mrs. Mapia. Thank you very much for the wonderful work done. We are having a presentation. I think Madam Bula.
Government yaffe ya Uganda.
Let's go and handle people in our world. People in our world.
Government kubanga eno tuli wala ate tufunye obuyambe obuwera. Obuyambe bujeeyo nga bitundu ebirala naye Ntoroko district tufunye obuyambe obuwera. Buno bw'omulundi bwaffe ogusoose kuba wano mu Ntoroko district tufuna buno obuyambe. Tusaba government mutuyambe eno tuli bubi abaana abangi.
Let's go and reach the world inside.
That's how we go to economic. Naweki tubentisaba government aburwaire kutuyamba aburwaire wa sickle cell hano ku district abarwaire baingi na nyowe na nyondoho ndi murwaire no karashidi nina abana basatu na bakozereki barwaire sickle cell kandi obuyambi tubuzoka ku district tubentuenda government kwataniza na kile kitongole ekyeje cy'abazungu kuvuga mu America cya Sarafinah kora cyatuyamba n'inyo government kwataniza ni kitongole kinu kora kwatunga obuyambi mu Ntoroko kuba hirwalo lya kantu hano sawu obuyambi ubona busahu cyome cy'ukuma umuntu wa sickle cell tuli abantu bona barwenge acha abana bagenyi n'umubaita hano mu kibanza abana bari n'usaba government koleki ekuyambe hano mu Ntoroko district niko tunge byoma byo kora bataniza n'abana basajja niko baraganga na sigara ndio balu prashido wafunga
Mara nibanyeta ayira mbabaza kuvuga mkakunoza nisime kitongole cya Sarafinah obuyambi obwerengere kutuha mu buhereza Hajo nisaba batere amani ero lyato byanza gwe mibazi kuteite muno kandi mibazi ya sente kandi n'abana babiri nisaba kitongole na kameti kuyambe yetera hayibare kikyoma kisokebera obune kebera kisiga kuko bwami kutebona kutobora sente nyingi kusobora nisaba government ya etuletere ekyoma kisokebera obune nesuko niko tungo buhereza burundu ntubasima muno tune kitongole kizire kutuhereza obuhereza no kuteka mu amani tihantu basaba batwekambise tuletere emibazi obujanjabi niko tusobole n'abana kuba kurungi no buyambi obuni babanza batwetera abo abana abana beja ku mwana ja kuba kuja hairwaro usange emibazi teroho anyuma baze kwandika kujugura na sente no tanzine anyuma no genda kukaribana no genda mukwerarikira kandi umwana n'abana kandi ubiro bunu buruma muno kandi tukabana kwa bariro nibenuba niba nibenda kulya kurugo niba batakwenda kulya kurugo niba batakwenda kubatalibani kandi saba batuhereza obuhereza omukumatuma araho n'abana.
So we are going the other side.
Build your muscles, Francis.
Tugende. Aha, eh.
I'm asking the government to provide us much medicine in Ntoroko district.
Let's go.
My name is called
You can start from where you ended, yeah?
We lack enough blood in the body. We get too much pain. And it comes through joints.
Please, I urge the government.
a disease that when it attacks you, it makes you to stay at home, not in school. While other children are learning, when for you are not learning, then that is the challenge.
Mother of 3 children with sickle cell disease, so I definitely empathize with the father who spoke to the different challenges. We feel for you. We want to be here to support you. Thank you for sharing your stories with us. We're honored to support Sarafinah Sickle Cell Society, which is our partner on the ground here in Uganda. We're visiting for the next week or so, and we're going to be gone, but please know that we will continue to carry you with us and support you as best as we can and advocate for you with the Ministry of Health. Whatever we can do to lessen the burden for the care team, we're here to do that. As caregivers, I want you to keep doing what you're doing to support your kids. I know it's not easy. As a warrior, I want you to keep doing what you're doing to, keep healthy, get enough rest, stay hydrated, listen to your care providers. But I know it's not easy, but I know you guys, sickle cell is not going to define you. Do what you can to rise above it. And thank you so much for having us. And I'll call
adults who are affected by sickle cell disease in the United States. That's my practice in my profession over the last 20 years. I also am the head of Sickle Forward. Sickle Forward is a nonprofit organization from the U.S. that I started in order to make sure that one day we can see a time when everyone affected by sickle cell disease has access to a diagnosis and access to the appropriate treatment for the disease so that we can overcome many of the problems that so many of you here today are experiencing. We are so thankful for the opportunity to come to Uganda and ultimately to be able to travel here to Ntoroko to be with you today. Sorry we had to come out on a cold day to bring you out here after rain and cold weather. But I heard the stories, what you're talking about today. We were listening and we were hearing and we're working with Sarafinah Sickle Cell Society, also in connection with the Ministry of Health here in Uganda to do what we can to bring access to care, to improve the services that you have, and hopefully to be able to link you with those medicines and those treatments that we know improve the disease and ultimately help to save lives related to the disease as well. So thank you, it's a blessing to be here.
Because we are trying to get them out from the communities. And one of the challenges we are receiving is intensified mobilization. We are still lacking people who can go out to the communities and talk to the parents of these children so that they embrace the management of sickle cell. Secondly, when sicklers are brought here and are confirmed, we have a challenge of doing the renal function tests and liver function tests because we don't.
MTS, thank you very much. Asiko forward.
A partnership between Sarafinah Sickle Cell Society, my organization, MTS Sickle Cell Foundation, and Sickle Forward. We've done a lot of traveling in the last week or so around the district, 4 or 5 to be exact, and just taking account of what's happening on the ground with regards to sickle cell, how it is diagnosed, how it is treated, and how the families are coping. And I have to be honest, it's been gut-wrenching. As a parent myself, I have 3 children with sickle cell disease. I know how hard it is to see your child suffer in excruciating pain and not really just basically outside of medical care.
Yes. Thank you very much.
We have a long way to go in terms of sickle cell management.
And we are winding up.
Currently
We are winding up
screening
the screening
or have
exercise.
just recently started
From
screening.
here we are moving to the Fremlong Primary,
Initiative
Kalabut Primary, Shalab Football match
Sickle forward.
between Novesid and Kalabutu Secondary School.
There are still barriers with those as well, because a part of this initiative is to screen children and enter them into care. And some of the facilities cannot do that because they don't have the infrastructure, the tests necessary to ensure that, yes, we're giving children medication, in this case hydroxyurea. There are certain tests that's necessary to ensure that the medication is working. A lot of the centers do not have the machines available to really test and ensure that the patients are safe. So I think one of the things we're going to take back with us is to continue being the advocates for patients that we are, continuing to engage with the government to do what they can to improve the infrastructure of the healthcare system, not just for people living with sickle cell. Of course, I'm a sickle cell advocate, and I'm going to speak for sickle cell, but I think this will help a lot of the Uganda citizens, because when we visit the wards, we're seeing that sickle cell patients and sometimes the general population are housed in the same units. They're understaffed. Sometimes patients are sharing beds, which is not wise. Sometimes they don't have the medication needed to really help the patients. And one thing we know about sickle cell is a huge hallmark of sickle cell is pain crises. And some of the hospitals don't even have enough pain medication to be able to alleviate the pain that the patients. They're relying heavily on blood products, and even there are some constraints. Not all of the patients have access to enough blood. We heard in one of the facilities, actually a few of them, where they've lost patients waiting for blood. So there's just, I think systemically, it's a lot of problems. And as a parent myself, I see myself in all of these parents. I see my kids in the warriors. It's really hard to watch. My commitment is to continue to advocate, to continue to support. If I can increase the level of support that my organization offers to Sarafinah, I'm going to support. But just to ensure that everyone knows their status. That's the goal here. Because when we know our status, if you're a person who is a carrier, if you have the trait, you're also given education to know that if you have the trait, if you have a child with someone else who has the trait, there's always 25% chance that the baby will come out with the disease. And also that if they have the disease, that we can enter them into care. But we understand that right now, the system is just not there. It's very challenged. It's there, but it's not. It's challenged. That's the best word I can think of. We're grateful that the government is doing something. There is a centralized testing initiative with Uganda that many other African countries could learn from. But we know that not all of the country is a part of this testing effort. So it's important for us to bring everyone, to ensure that all babies born within Uganda have the test that they need to ensure that they know their status. And that if you are confirmed to have sickle cell disease, that the care, the service is there to ensure that we are fighting, because right now what's happening in sub-Saharan Africa, and Uganda is no different, is that upwards of 70 to 80% of babies born with sickle cell disease, they do not live past the age of 5. We really want to put a dent in that figure, because there's no reason why, with all of the advances that's happening in sickle cell currently in other parts of the world, we're
talking about disease-modifying therapies that can help patients live well with sickle cell. We're talking about gene therapy that is curing people of sickle cell disease. I pray for the day that Uganda can be a country where you're born with sickle cell disease and it's not a death sentence, and that you can get the care that you need. You can live well with sickle cell, you can thrive with sickle cell, and you don't feel stigmatized. That's another thing that we're working on. We need to ensure that we're educating the masses about sickle cell so that patients and their families do not feel like they have to suffer in silence. They have to feel ashamed to, be out in general population. Sickle cell is not a death sentence. I mean, it's really hard to deal with right now in Uganda, but we just have to encourage our people who are impacted by sickle cell disease, that they have the support that they need, that they're not alone, and there's really no need to be powerful. It's important to share how they're feeling. It's important to build communities. I look around, I see at least 50 parents come together, support each other. You may not have everything you need, but you have a community who understands what you're going through. Sickle cell affects everyone differently, but there are certain hallmarks. We all feel the sense of helplessness when our children are in pain and there's nothing we can do. We all feel the sense of socioeconomic constraints, because if your child has sickle cell disease or you're an adult who has sickle cell disease, if your child is in and out of the hospital, it's hard to maintain employment. I feel like that's a universal thing. So the system is overwhelmed, and we all have to come together. Whether you're impacted with sickle cell disease or not, we all have to come together to do what we can to help in our own ways.
For treatment. And so that's where partners like my organization, Sickle Forward, we're partnering also with the MTS Sickle Cell Foundation from the United States, and then of course, and most importantly, with the Sarafinah Sickle Cell Society here in Uganda, which is led by Sarafinah Sickle, who's a lived experience individual affected by sickle cell disease. And it's through partnerships like this that we can try to come beside these health centers that are doing good work and bring rapid diagnostic tests that can very quickly diagnose those with sickle cell disease. Our project is focused on those from 0 to 5 years of age, and we're providing diagnostics for any children coming into these health centers, both Health Center 3s, Health Center 4s, and then regional facilities within the districts where we're working. We also think that it's not only important to make a diagnosis, but also to link those children diagnosed to critical care. And that's maybe even the most important step. And so we are working on avenues to bring low-cost hydroxyurea here to the districts where we're working, so that those impacted by sickle cell disease can have access to this very important care.
Of MTS Sickle Cell Foundation, based in the United States of America. I came with my wife, my pillar, who is working in collaboration with Sarafinah Sickle Cell Society to help the population that are suffering from sickle cell here in Uganda. Our purpose mainly, again, is to come and sponsor everything that Sarafinah is doing to help promulgate the information to education and whatever resources we can have coming from the United States of America. That's by far a Conga. Very interesting. I like the layout, the atmosphere, the topographic, the good people who have photo hospitality. It's very beautiful here. I love the people because they are very friendly, very welcoming. That's a very good thing that you see when you travel around the world. I've been around the world, but not everybody that act like this, not everybody that receive you and welcome you like we have seen here in Uganda. So we're very appreciative. To understand one thing, sickle cell, first of all, affects people differently and so many different things. And so when a patient is diagnosed with sickle cell, you got to involve the parents. And then the parent will help in the healing process by providing necessary adequate resources, medication, and social services. You can't only focus on medication alone because you will provide the medication, but there are other things that that patient needs. There are other things that the caregiver needs. So from that perspective, you got to have a holistic services provided to that servant or to that warrior to help heal that person from whatever disease that person is suffering from. Sickle cell is very dangerous. A lot of people suffer from it without even knowing. Some people can attribute that to witchcraft. So in the healing process, it requires a team. All right, the medical provider, the staff, you guys, and also the caretaker. Yeah, in collaboration with Sarafinah Sickle Cell Society, definitely we will do what we can in the United States to help Sarafinah to do what they got to do here and helping the people.
For our local people. Our visitors from America, you are most welcome. Thank you for choosing.
Uganda team, they're playing well right now. Yeah. So he's having pain.